Hello, everybody. My name is Maarten Akkerman, or should I say Yasu to everybody? It's strange that I can only see myself and not all the attendees on this call or meeting, so we'll have to do it this way. I look forward to indulge you in the next 10 minutes in what we do as Medtronic, as a company. I'm responsible within Medtronic for the EMEA region for medical affairs and value-based healthcare. I want to show you a couple of things that we have been doing in these last few months, but also in the years before on treating patients on more remotely, but also coming up with digital and electrical solutions to treat patients differently without the hospital, within the hospital, but also outside the hospital. If we can pull up maybe slide one. I prepared a title. I think it's together. I think it's very important to say together because this is something that we need to do all together. Healthcare professionals, industry, governments, payers, everybody needs to help each other to face the new challenges that we are looking at, but also to address new ways of care delivery. Um, Next slide, slide two. As you can see from my, maybe hear from my accent, I'm Dutch. And in the last weeks or so, we have done a big research project together with the National Cardiology Association and Medtronic and a research organization on what the impact is of the patients that have not been treated due to the COVID situation. And actually, what we found, and this was specifically for cardiology patients, is in that the last 8 weeks, around 350 to 400,000 non-COVID cardiology patients have not received the appropriate cardiac care that they should have gotten. And this resulted in a quite shocking number, is that we estimated in this research, together with the National Cardiology Association in the Netherlands, that 65,000 until 100,000 life years were lost. This means that around 6,500 to 10,000 patients have lived 10 years less than they normally would have when they would have gone to the hospital. So it makes very clear that there is a certain need to address another crisis that is arising on the horizon or is already manifest, and it's not the COVID crisis. It's treating the patients that have not received this care. And if you see at what kind of scenarios we should look into, or different ways of handling this care, I think this is something that we need to address both. As Medtronic, we have a mission and vision that is very aligned of providing medical technology to patients and healthcare providers, but also making sure that these technologies achieve the best outcomes. And I think that is what we jointly should do, and that should be our ambition. If you look at the next slide, slide three, what we have done also in this research is looked at what are the main barriers of people not getting appropriate care. And keep in mind, this could also be a non-COVID situation, but this is what we focused at in the current COVID situation, in this case in the Netherlands, but probably it also applies to Greek or other regions. And the first thing is that there's lack of insight in the organization. So what is actually going on? How can we optimize our logistics? The other thing is that there's capacity constraints. You can imagine that ICUs were lying full. OR rooms are being, inadequately used because of the ICUs were full with COVID patients. And the third thing is that we see is that clinics were not possible to actually retrieve patients because the situation was not safe. And I think another very important thing that we saw is that patients actually were scared of going to the hospital, which they, went not to the general practitioner, so they postponed actually their care. So these were the main four buckets where we saw that, a kind of backlog was coming of patients that did not and still do not receive the adequate care. And if you look to the right, there are also, can we go back, please? If you look to the right, there are also different scenarios that we have to take into account. This could be a one-time thing. This could be a recurring thing. This could be, managed now, but it could come back even worse. So there's constraints that we see, capacity, motivation, patients itself, but also education, and there are different scenarios. So there are a lot of variables that we need to take in account. Next slide, please. As a company, and if you could pull up the next slide. As a company, Medtronic is the largest medtech company in the world. We treat more than 65 diseases. So we're present in many ways in the hospital, but also out of the hospital. We have developed e-health solutions for remote monitoring, telehealth monitoring, and we have done that not only for the last 6 weeks or 8 weeks, but we have done that for the last 6, 7 years. And we have gained a long track record and long establishment of how can we actually treat patient in a different way, which not necessarily means that every patient needs to go to the hospital, but that means that we can also, pool resources in the hospital, but treat the patient outside. And for example, we have done that with cardiology patients. One example I will show later is Focus On, but we also are the largest supplier of diabetes care with our diabetes pumps. And I will have an example for that also later. Next slide. One example is all these devices that for cardiology patients, for example, create a lot of data, and this data abundance is creating a new problem in hospitals because the doctors and nurses do not actually know how to cope with all this data flow. So Medtronic does not only bring the devices, but they also bring solutions that interpret the data in a very intelligent way. So we have artificial intelligence solutions where we actually can monitor patients with help of the hospital, of course, and that we can filter out, if you want, these patients that actually are in need of care, and those patients that are not in need of care, we just leave them alone and we only bring them into the hospital when it's needed. This makes up and frees up capacity. This makes sure that the right patient gets treated at the right time at the right place, which is in this case the hospital when it is urgent, and this might be in the general practitioner setting or a lower setting of care when it's needed. So we have different solutions in place. I think this is a very important thing that we need to address and need to develop even more urgently in this new COVID situation, because it's obvious that hospitals will have a lot of on their mind. They had a lot of in mind. Capacity is a constraint. So we have to think about new ways. How can we actually treat these patients and treat these patients at the right time, at the right moment, and at the right place? And this means that we have to, think about innovation, but we have to think about innovation of healthcare delivery in itself. So where do we actually treat these patients? How do we enable and facilitate doctors and nurses and healthcare providers to have, their attention and their energy and their time on those patients who actually need it? And for that, we have to develop new solutions. And if you go to the next slide, one example that I want to highlight, and I could talk, about ages about this. This is an example also in the Netherlands where we have built a clinic for type 1 diabetes patients. And this is a hospital. It doesn't look like a hospital. It looks more like a home care or a very cozy place where we actually treat these patients. So we treat these patients, not giving them the feeling that they're actually sick or in a hospital. And this is called Diabetes. And the last 3 weeks, we treat about 3,000 patients in this clinic. We have managed during the COVID crisis to treat all these 3,000 patients outside the clinic. That meant that the care providers, the dietitians, the psychologists actually worked from home, treating the patients from home, because we already had built an interface, an e-health solution where we actually pull data from the devices, pull data from all measurement sensors into the clinic and interpret them, and only treat these patients or connect these patients when it's actually needed. And this gave us the chance, actually, although it was a crisis, actually to close all our facilities, all our 6 facilities in the Netherlands, and treat these patients completely remotely. And we have measured the last 6 weeks, we have also measured the results per patient on blood glucose, on hospitalizations, and actually the results have not worsened. Actually, they have improved as well, because there was more time to actually focus on those patients who actually needed it. We had, of course, no shows at clinics, which also gave the doctors more time to spend more time with the patients. So these are just, in 10 minutes, 2 very explicit examples how Medtronic, together with healthcare providers, with governments, but also with payers, wants to bring solutions and wants to be part of the solution on this crisis, which has provided us many new insights, but also made us very clear that there is a new way of doing actually healthcare, which is much more remote, and gave us also insight that not every kind of care has to be in the hospital, but maybe most of the care, most efficiently, can be outside the hospital. Of course, in close collaboration with the hospital and the care providers outside the hospital. And I think that would be my message for these 10 minutes, is that Medtronic is super engaged, wants to be part of the solution, is very aware that there's a lot of things that already are being done. And I have to give the compliments to all the people also in Greece and the care providers and everything that you have to have done to manage this crisis. But there's also a midterm and long term where we have to look at. And let's take the lessons from COVID and also bring that to the new future, and that we can treat patients, hopefully not for a new COVID crisis, but also treat patients better in the future at home. So this would be my presentation. Thank you very much for listening. It's strange not to have interaction with you. I hope you find it interesting, and if you have questions, please put them from front.